Mast cell activation syndrome, or MCAS. Mast cell activation syndrome, or MCAS, is one of several conditions that fall under the mast cell disorder umbrella. These disorders are characterized by either the abnormal proliferation or activation of mast cells within the body. MCAS in particular involves the abnormal activation of a normal amount of mast cells. What is a mast cell? Mast cells were discovered in 1878 by Paul Ehrlich. Noticing all the granules within the cells, he named them mast cells after the German word for well-nourished. Mast cells are actually immune cells that are found in many different tissues and organ systems of the body, particularly those that interface with the outside environment, such as the skin, lungs, and digestive tract. They're responsible for protecting our bodies against threats from pathogens and injury. Some mast cell activation is normal, even necessary, for maintaining homeostasis. However, MCAS occurs when the activation is greater than the perceived threat. Mast cells can secrete up to 200 of what are called chemical mediators. These can be pre-stored in granules or made upon activation of the cell. Degranulation is when there is a sort of mass exodus of granules all leaving the cell at once. This is what happens when a person experiences anaphylaxis. In fact, for a long time, people thought that mast cells were solely responsible for the release of histamine and involved primarily in allergic conditions. What research from the past decade is now showing is that mast cells have receptors for many more stimuli than just IgE. They can release many different chemical mediators involved in everything from inflammation to migraine headaches. In fact, we don't even know what all the mediators that mast cells release are responsible for. Furthermore, scientists now know that mast cells can release mediators selectively and not just during degranulation. In short, mast cells can be activated by many more triggers than just allergens and can be involved in many inflammatory conditions besides allergic reactions. Some of the triggers for mast cells include bacteria, mold, drugs, toxins, viruses, heat or cold, pressure, and stress. These lead to either the degranulation or the selective release of many different kinds of chemical mediators. Some of those listed above are histamine, serotonin, leukotrienes, prostaglandins, platelet activating factor, many different kinds of cytokines and growth factors, peptides, and a lot more. Since mast cells are found all over the body, individuals with MCAS have symptoms that involve multiple organ systems. In order to be diagnosed with MCAS, it has to involve at least 2 organ systems, but often presents symptoms that involve many more than just 2. One person diagnosed with MCAS may have a completely different set of symptoms from another patient with MCAS. Symptoms may present differently at the same patient at different times. Currently, there is ongoing research that is looking into the link between mast cell activation and conditions such as autism, irritable bowel syndrome, chronic pain, multiple sclerosis, and a lot of other inflammatory conditions. So just to summarize, mast cell activation syndrome occurs with the overactivation of mast cells that cause them to overproduce and release too many chemical mediators. They can have many different triggers, including but not limited to IgE allergens. The severity of the condition can vary significantly and can present differently among different patients. Since mast cells are found all over the body, the disorder generally affects at least 2 multiple organ systems, often more.